the journey of life. The sperm is produced 1,500 new spermatozoids per second, produced by the seminiferous tubules. They move in 1 to 2 days towards the epididymis and stay there for 3 weeks. If a sperm were human-sized, say 5 feet 7 inches, the equivalent distance to find the ovum would be about 28 miles, roughly the distance of a marathon. That's like the distance from San Jose to San Francisco Airport, or 2 round trips across the San Mateo Bridge. The sperm will travel through the vas deferens, which is 12 inches long, equivalent to 300 feet or about 150 meters. That's longer than a football field. At a velocity of 28 miles per hour, ejaculation velocity is about the same as the maximum sprinting speed of a well-trained athlete. Sperm can reach fallopian tubes within 5 minutes and can reach the egg in 30 to 60 minutes because of the assistance from uterine contractions. The spermatozoid can remain viable in the female for up to 7 days. Now in the vagina, uterus, fallopian tube. If a sperm cell were human-sized and had to travel 28 miles, its average velocity would be about 5.1 miles per hour, which is similar to a walking pace. The ovum is roughly 20 to 25 times larger than the head of a sperm cell in diameter. If a sperm were human-sized, finding the ovum would be like looking for a giant dome-shaped building in a vast city. Approximately 350 million sperm, which is about the population of the United States, are released into the vaginal canal during ejaculation. But this journey is not easy. Many sperm will die immediately due to the acidic environment of the vagina. Only a few thousand will survive and begin the race toward the egg. The strongest sperms swim through the cervix into the uterus. The uterine contractions help push some sperm forward. Many get lost, trapped, or destroyed by immune cells in the uterus. Only a few hundred make it to the fallopian tubes where the egg is waiting. If ovulation just happened, the egg, or ovum, is sitting inside the fallopian tube, waiting. The egg is surrounded by protective layers, the corona radiata and zona pellucida. Sperm must break through the outer layers using enzymes from the acrosome, which is a special cap on the sperm head. The first sperm to penetrate wins. Remember this. Who is the winner? The winner is you. You are the one out of those 350 million. So that is why you are special. Can you imagine you are the winner from all United States population? Once one sperm enters, the egg immediately locks the door, known as the cortical reaction, to prevent more sperm from entering. Fertilization occurs when a sperm penetrates an ovum and they unite. This takes place in the outer third of the fallopian tube, near the ovary. Further sperm are then prevented from penetrating the ovum. Fertilization occurs in the ampulla of the fallopian tube within 24 hours of ovulation. The egg and sperm nuclei fuse, forming a single zygote, which is a one-cell organism with 46 chromosomes. This marks the beginning of human life. The zygote begins producing HCG, but it cannot be detected due to low concentrations. The zygote is formed by the union of sperm and ovum. It's then transported through the fallopian tube into the uterus. During this transport, the zygote undergoes rapid mitotic division, known as cleavage. The size of the zygote does not increase. Instead, the individual cells become smaller as they divide. Eventually, they form a solid ball known as a morula. After fertilization, the zygote travels to the uterus for implantation. Implications of an abnormal tubal structure. Ectopic pregnancy, which is the implantation of a fertilized egg outside the uterus. The causes include blocked or scarred fallopian tubes, often due to infections like pelvic inflammatory disease, endometriosis, or previous surgeries. Abnormal cilia function can also be a factor, influenced by smoking or genetic issues. Additionally, hormonal imbalances affecting tubal motility, such as those involving thyroid hormones, estrogens, and progesterone, can contribute. The implications of an abnormal tubal structure. Dr. Guillermo Paredes, Maryland, MS, RDMS in OB and AB, RVT and VT, explains, ectopic pregnancy is when implantation occurs outside the uterus. Dr. Guillermo Paredes continues, the consequences can be severe. Tubal rupture can lead to life-threatening internal bleeding. Severe abdominal pain and vaginal bleeding require emergency care. Since it's a non-viable pregnancy, it needs medical or surgical intervention such as methotrexate or surgery. Dr. Guillermo Paredes further elaborates, the zygote begins cleavage, which is cell division where each cell is called a blastomere, as it travels down the fallopian tube toward the uterus. Day 2, 2-cell stage. Day 3, 8-cell stage. Day 4, morula, a solid ball consisting of 16 to 32 cells. The morula keeps dividing as it moves toward the uterus. The consecutive cleavages reach the morula stage on the 4th to 5th day after fertilization. On the 6th day, the morula turns into a blastocyst. The morula hollows out and becomes a blastocyst, which is a fluid-filled structure. The blastocyst has two main parts. The inner cell mass, or ICM, is the future embryo. The cells differentiate into the ectoderm first and the endoderm second. The trophoblast will become the future placenta. Cytotrophoblast. The uterus is ready and the blastocyst searches for a cozy spot to attach. The trophoblast releases enzymes to burrow into the uterine lining. Once attached, the blastocyst fully embeds itself into the endometrium. This marks the official beginning of pregnancy. By day 6 after fertilization, the concentrations of HCG are high enough to be detected. Between days 6 and 10, implantation occurs. Implantation usually happens in the upper section of the posterior uterine wall. Cells burrow into the prepared lining, endometrium. Endometrium, now called decidua, thanks to progesterone. The area under the blastocyst is known as decidua basalis. This area becomes the maternal part of the placenta. As we conclude our journey, let's reflect on the decidua and its pivotal role during pregnancy. This specialized endometrial lining, responding to progesterone, is essential for supporting implantation, nourishing the embryo, and modulating the maternal immune response. Decidua is the specialized endometrial lining of the uterus during pregnancy. It forms in response to progesterone, supports implantation, nourishes the embryo, and helps modulate the maternal immune response. After childbirth, it is shed along with the placenta. Types: Decidua basalis, site of placental attachment. Decidua capsularis surrounds the embryo. Decidua parietalis, also known as decidua vira, the remaining uterine lining. The name comes from Latin deciduous, meaning falling off, referring to its shedding after pregnancy. Decidua. Important for nursing exams. For NCLEX-style questions, you may see scenarios involving implantation, pregnancy complications, or postpartum assessment, making decidual function a key nursing concept. Dr. Guillermo Paredes, Maryland, MS, RDMS, OB, AB, RVT, VT, says the embryo starts producing HCG, but it is only at the time of implantation that the levels of HCG become high enough to be detected in pregnancy tests. Dr. Guillermo Paredes, Maryland, MS, RDMS, OB, AB, RVT, VT, explains, the placenta begins forming and the embryo continues growing over the next 37 to 42 weeks, LMP. 40 weeks, which is 9 months and 7 days, LMP, 280 days from LMP, 266 days from fertilization. The placenta is fully functional at 11 to 12 weeks. The corpus luteum in a non-pregnant cycle lasts 14 days. The corpus luteum in pregnancy lasts around 10 to 12 weeks, depending on the individual's pregnancy. HCG enters the mother's blood and signals the corpus luteum in the ovary to keep producing progesterone to maintain pregnancy. The fastest way to determine pregnancy is a quantitative blood test, also known as a BHCG test, at a medical facility. This can be done 6 to 8 days after ovulation or 1 to 2 days before a missed period. The fastest urine test for early detection is a home pregnancy test.